And it's our special 9 o'clock Newsmaker show. It's 6 minutes after 9 right now. We have on the line with us St. James CEO Bryan ODonovan, Dr. Ismail Mehr, and Dr. John Robshaw. Good morning.
Morning. Morning.
Well, every day that goes by, Hornell seems to become more and more the epicenter of this COVID-19, and you have patients at St. James who have it. Where would you like to start, and who would like to get started this morning on our show?
Yeah, hi, this is Brian. I'd like to actually start with thanking all of our providers, our nurses, and our frontline workforce. They have done an absolutely tremendous job. I want the community to know this. They're working all hours, and they've just done an extraordinary job. I could not be prouder of the team that we have here.
Okay. I guess I'll start with Dr. John Robshaw in the ER. Can you say if cases are coming in of COVID-19, did they come there first, or what can you talk about there? Obviously, we don't say names, but what can you tell us, Dr. Robshaw?
Well, we've had a steady flow of patients with suspected COVID, several of whom have tested positive, several of whom have been hospitalized, and the sicker of that cohort have been transferred up to Rochester. The University of Rochester, I should say the University of Rochester specialist team there are very absorbent. They've actively asked us to send all sick patients there. These are people exclusively on ventilators who need immediate respiratory care. The problem with the COVID is the scope for really rather rapid deterioration in respiratory functions, typically around day 8 through 10 of the symptoms, and we can predict that at the bedside. We don't wait for people to get super sick. We have the conversation with them that this is the time to act, get them heavily sedated, anesthetized. That's where my colleague Dr. Mehr comes in, and get them on the respirator and get them to super specialist care for definitive assessment and ongoing treatment. So we've been doing that much like we do with heart attacks and strokes. We do the immediately necessary basics, and then we know when it's time to ask for assistance. And so far, it's worked wonderfully smoothly through massive amounts of teamwork and great medical skills here in the building, I think.
You brought up Dr. Ismail Mehr there in your answer there, Dr. John Robshaw. Dr. Robshaw, or Dr. Mehr, I should ask you, you're normally incredibly busy, have an incredibly busy schedule, I'm sure, as the anesthesiologist at St. James, but I'm guessing now with your involvement with the respirators, with the numerous COVID-19 patients in the area, that you're doing even more work.
Yeah, so, I think something I wanted to share was that we're unique here at St. James and the University of Rochester. I think we were one of the first healthcare systems, and when I say healthcare systems, it's, University of Rochester and all of the partners and facilities under that banner. We stopped doing elective surgeries before the governor even asked for the state to stop doing that. And I think that shows tremendous insight from all our leadership from Rochester down through leadership here in Hornell, where everyone was on board. And that gave us a lot of time to start preparing. So, yes, I've been busy, but it's been, we've been doing a lot of preparation these previous 2 weeks. And our local surge has just started, and like Dr. Robshaw was saying, we really thought multiple plans through, and we had things ready, nursing staff. We reallocated assets to different parts of the building. The governor had asked all hospitals in New York State to increase capacity, to try to increase capacity by 100%, but the mandate was 50, and we were able to increase that by 100%. So I think that says a lot for this team here locally. That we were ready for this, and it's been busy last 72 hours. Definitely these patients are very, very sick. Within hours, they what we call crash or become so ill that they can't breathe on their own, and we have to respond very rapidly, but in a safe manner for staff and safe for our patients. And I think everyone here has been doing a tremendous job, and I can't thank the nursing staff and the techs enough because they're the ones who make John Robshaw and my job much easier, and it's kudos to them.
Dr. Mehr, can respirators be used outside of the hospitals? Do you ever take a respirator over to doctor's offices if someone's sick outside of the hospital, or do you ever do respirator house calls and deliver a respirator to someone, or is that something that has to stay inside the hospital?
Those patients are extremely, extremely sick. That's something for ICU care. We also have developed a plan here in case I don't anticipate and hope that things will get saturated in the other hospitals in Rochester. But just wanted to rest assured to the community that we have all plans in place. Right now, anyone who has to be intubated or have a breathing tube, we make sure they're stable and safe, and then the team is on the phone with the chopper, and we're getting them up north as they still have beds. We hope nothing changes, but if it does, we have multiple plans in place to ensure that we can take care of all types of patients right now.
So, Brian, I'd like to add on to that. We do have our own surge plan. We've reported to the Department of Health. We have to double our occupancy at least by 50% and then 100%. We have that in place, although staffing does become somewhat of a challenge. The University of Rochester system already has their surge plan in place. They have beds. I will tell you, the predictive models right now show that, at least that I have seen, show that Rochester could be at its peak at the end of April. It is very possible that all of those beds are full. And so we need to make sure, as we have been the last month, that we're able to take care of vent patients in-house at St. James Hospital. So we'll continue to make sure we have our policies, procedures in place, which we already do. You know, we're planning for the worst, hoping for the best, but this is going to get worse.
Do you have a sense on that topic, Bryan ODonovan, or either of the two doctors, Dr. Mehr or Dr. Robshaw? You talked about Rochester being pretty filled up. Do you have a sense of who is more filled up, Strong or St. James?
Well, I think right now there are beds there. They're having a lot of patients, but everyone has made arrangements for increased capacity. So right now they're not full. They're getting... They
being Strong, Dr. Mehr?
Target every day. I think, right, Dr. Robshaw, every day is a different day. You know, we've had a bit of a revolving door here at Hornell, and I think we need to really, really buckle down on our social distancing locally. The last 72 hours, we've had 20 patients come through this hospital and be admitted, get sick within hours, have our rapid response team get involved, intubate, place lines that are for critical care, for life-saving type measures, different types of IVs and stuff, and packaging them and making sure there's a bed in Rochester. If we continue at this rate, we're going to overwhelm ourselves regionally, because then everything will start filling up in Rochester. So we really, I can't stress enough, and the mayor and the hospital sent out that statement that we got to really understand that we are the hot spot. As Dr. Robshaw has made very clear to us, we are the epicenter of Steuben County. There's no joking or that's not anyone BSing here. So we really need to start watching what we're doing, or it's going to get worse locally.
Talking with Dr. Ismail Mehr, Dr. John Robshaw, both from St. James, and St. James CEO Bryan ODonovan. Now I want to open up a topic. There's a lot of talk on social media. There's a lot of talk on talk shows, some of which we carry, some of which we don't. And basically, you've got, I would say basically you've got two different groups. You've got the people who think this is very serious, and it's going to get worse. And then you have those who are, I would almost describe as overconfident. We can beat this thing. I'm not afraid of it. Are you afraid of it? And political criticisms of everyone from the governor to the president to a lot of criticisms of Dr. Fauci. I want any of our three guests to weigh in on this. What do you make of the talk shows and some of the things that have been said, critical of the governor and critical of the president, critical of the CDC, critical of the health departments, etc.?
So I don't have really a comment on that, Brian. What I can tell you is, in terms of your question about the seriousness of this, I would challenge anyone to ask any of our staff, our nurses, our doctors that have taken care of these COVID patients how serious it is.
Dr. Robshaw, would you like to say anything? Yeah, I mean, the seriousness of this is unequivocal. I mean, as it's traveled from west to east, it's literally killed thousands. I don't know how anybody can overlook that. It continues to kill in urban centers in New York, and it surprises me somewhat on a daily basis when the news says, "Oh, we've got so many more cases, and now we've got this number of cases." I'm afraid that's the way it's going to be. This is predictable now. I can tell you what next week's news is going to be. It's not trying to take your job here, Brian, but
no.
The number of cases are going to go up, and in terms of those who gainsay it and say this is a hoax or it's been overblown. I'm minded to quote Paul Getty, the oil billionaire, who in 1947 said, "No man's opinion is better than his information," and I don't think there's a better quote that I could say at this time.
You get these comments from some that say the economy is more important. We got to get back to work right now. How would any of you answer that?
Brian, we're in healthcare. Our focus is on our frontline staff and our patients. I don't really have a comment in terms of the economy at this point. We're in the business of saving lives, and that's exactly what we're doing.
Talking to Dr. Ismail Mehr, that was St. James CEO Bryan ODonovan there, and Dr. John Robshaw, the emergency room head. We're going to take a quick break. We'll be back in 60 seconds with St. James. Stay with us.
For now, I'm the only one allowed to visit the artist in residence at Walker Metalsmiths. Let's see what he's up to. What you doing?
Making a diamond engagement ring.
So I see it as a cathedral sort of design with...
Hush, not on the radio. It might be a surprise. You never know who's listening.
Right. You have made a lot of wedding and engagement rings. Which was your favorite?
Remember that couple from the festival in Fairport?
That could be a lot of people.
3 years in a row, they came in during Canal Days Festival and shopped for a ring, but insisted they were not getting engaged or married.
They dithered for 3 years before you showed them that awesome purple sapphire.
Both of their faces lit right up, and I knew it was going to be theirs.
I remember when they came in to pick it up. He made her wait outside, he brought it out to her, and proposed right on the steps of Walker Metalsmiths.
It was great. The ring is nice, too.
I think Steve likes telling stories just as much as he loves making jewelry.
I miss seeing our customers, but you can still connect on Facebook, Instagram, and through our website at walkerscelticjewelry.com.
And we're back on the Newsmaker show now with Dr. Ismail Mehr and St. James CEO Bryan ODonovan. Earlier we were joined also with Dr. Robshaw, who's been called off to the emergency room. This question, I guess, for Dr. Mehr. Tell us about the supplies at St. James, not just the PPE, the masks and the gloves and things like that, but supplies in general.
You know, I think preparation is key for anything. You know, you're always prepared. Generals prepare when they're going into war, and I think, you know, our administration leadership and our task force team, the 2 weeks prior to the surge here, we prepared well. We looked at everything we need, and you know, I, as a physician, not just as part of you know, a leadership or a task force team, can say that, you know, we're blessed. We have PPEs, we have face shields, we have masks, we have N95s. We have all the things that are necessary to keep us safe. And from the university down through our leadership here, the message is always first, staff safety and patient safety. And they're a very close 1 and 2. We're not sacrificing either one of them. But you have to have the staff safe to continue to be able to help and treat people. Sunday night or Monday, I can't remember exactly. I think it was Monday. We were about over 100% capacity here. We were really busy, and everyone was safe. So we have the supply chain right now. Obviously, things can change. It's a moving target, and it all depends on the local surge. And if people don't listen and keep going out and keep getting sick, then at some point it's possible to start putting myself and my colleagues, might be at risk. We don't anticipate that. The university has been great, but it's just a message out there is that please don't get sick and come here so that we can continue doing our job and helping the people that really need it at the time.
Yeah, I think what I would say is, this is avoidable by washing hands as well as social distancing. St. James, over the past month, we saw this coming, not on this pandemic stage by any means, but certainly, knew that this virus was making its way to New York State. We already had procured appropriate PPE. We continue to stay between 10 and 14 days on hand. We report back to the university every single day. We're looking at our PAR levels, our supply levels. to make sure, as Dr. Mehr had said, that our staff are safe, and that is the most important part here, as well as our patients. So the supply lines are intact. We are very grateful for the university, for the GPO. They obviously have a significant amount of leverage based on their buying power versus if we were a singular entity, which we are not.
I wanted to ask, and this question is for either of you, Bryan ODonovan, the CEO, or Dr. Ismail Mehr, the anesthesiologist. Any advice for families who would want to give a family member or a friend a handshake or a hug right now, especially when you're looking at maybe a person who has COVID-19 and you're feeling terrible, you're terribly worried, you love your mother, your grandmother, or whoever, and you want to give them a hug. What would you say to that person?
Yeah, first and foremost, absolutely not. Now, if you're all living underneath the same roof, you're all contaminating each other anyways. So that might be, your child or someone. Yes, you're immediate people in the one roof. Even there, I'd recommend some social distancing. But we all know when you live in the same household, that's not as easily done. However, if there's someone who's being isolated because they're suspected of being positive or being tested for COVID within someone's household, absolutely, you need to quarantine them within your house. But out in the public, grandmothers, aunts, uncles, wave to them from 6 feet away, if not further. I said on the show you had me on a couple of days ago was, you want to get out for a walk and get your kids out? That's okay. I take my kids out for a walk every day. I need to get out. I understand it. But I'm not stopping to socialize with the other family who's walking their dog. I walk right by them, give my nice nod, hey, how are you, and keep going. So, yeah. Go back to your question. We're not going out there hugging, shaking hands with anyone, and we shouldn't be doing that. Otherwise, we're going to perpetuate this issue here.
Dr. Mehr, medical professionals who are taking care of COVID-19 patients, how do you go home? Do you shower and wash up first, or do that when you get home? Is there a process there? Are there any protocols for that?
Everyone has their own process. And it's not just us, the physicians here. It's the leadership. It's Bryan, our CEO. I mean, we're all in this together. It's our techs. Everyone is concerned and worried about their families. We see what this disease does to people. We've seen people crumble within 6 hours of coming to St. James, going to the floor, and then all of a sudden we're having a rapid response for them. So we all have a system. I'm not sure how everyone does it, but rest assured, everyone has a system. Mine is I get home, I have a guest bedroom and bathroom downstairs. I'm in there changing, showering. Stuff goes in a separate bag, is in the garage before I can even enter the rest of my house. I think, Bryan can share what he does.
So on a personal note, yes, I change in the garage. I have an 8- and 9-year-old, Emma and Ashton, that are home, as long as my wife, who's a school teacher, and obviously home with my children. But I take it very seriously. I'm very cautious of the interactions with my kids. We still obviously play basketball and that type of thing and play together. But, it is in the back of my mind of spreading this. I'm washing my hands all the time to the point my hands are actually cracking. And I'm sure that my staff and our physicians, doctors, nurses are doing the exact same thing and have the same concerns. I mean, look, we're telling people to stay home. We're coming to work every day to take care of this community. There is certainly some anxiety on the level of all these folks that come in here on a daily basis.
Talking to Bryan ODonovan, the St. James CEO, and also Dr. Ismail Mehr, the anesthesiologist, heavily involved with this process because anesthesiologists are the ones who deal with respirators. Getting back to that topic, Dr. Ismail Mehr, if I could ask, how's the respirator supply holding up?
Yeah, so absolutely. We have a total of 18 ventilators here at St. James, which is, we immediately, and I can't keep going back to the preparation that we've all put in here. We started working on this 2 weeks ago. The university, like I said, was ahead of anyone else in the state when we closed down elective surgery and set an example for the region. And we have enough respirators for every one of our beds on our medical surgical floor if we had to get to that. Let's not get to that. That's not what we want. but the community can rest assured we're here, we can take care of them, and we can still take care of the other emergencies. We don't want you coming in for some of the run-of-the-mill things at times that can be handled by a doctor's office over the phone, or you can get it done. It's not necessarily a life-or-death emergency, but we have people coming in with broken ankles. We have people who are having chest pain. We're having other things, and we have a system in place so you don't have to worry that I really need to go to the hospital. I'm really sick, but I'm worried. You come here, there's a screening system, there's a separate entrance for people who are potentially COVID positive or have symptoms with that, and for people who are not, and they're screened there. So there's been a lot of thought process put into this, and you can rest assured we're here to take care of every type of patient, not just COVID patients, and I think we're doing an exceptional job right now.
This question either for you, Dr. Mehr, or for you, Bryan ODonovan. Dr. Mehr, you mentioned a separate entrance for COVID-19 patients. Everyone now, if I understand it, if my memory serves me correctly, that people are coming in through the emergency room and not the main entrance to St. James Hospital. Can you tell us that's correct, first off, and what would the separate entrance be, if you can say what it is?
Sure, Brian. So as of early last week, we closed our main entrance, and the reason for this is so we can screen all of our employees and our patients coming through one entrance. So masking, we're masking everyone that comes into our facility, including the medical office building. We've limited their entrances as well. So what we're doing is the first contact, we mask that patient, and then what the nurses are doing outside of the ED, because what we don't want to happen is a potentially COVID-positive patient walking through the registration area and then through the emergency department with potentially these symptoms, and we know transmission is by droplet. So if there's a sneeze or something similar to that, then that could then infect any staff or patients around that specific patient. So we're triaging, and then if we suspect that patient has any COVID-19 signs, we bring them around another entrance that is blocked off, and then it goes into, they go straight into an exam room to be treated.
Okay, we're down to the last couple of minutes. Is there anything I did not bring up that either of you would like to talk about?
Hey, Brian, I just wanted to give a shout-out to Jessica Fall, who's on the U.S. Comfort, someone from the community. I think the community should know, we have some heroes in different places right now doing some amazing things. She's on the, most people know her in town, so I can just do that in closing.
Sure thing. That's great. And Bryan ODonovan, anything there?
No, just, thank these frontline workers. I mean, the hours they're putting in and the care that goes into, what we're providing the patients. These folks are exhausted by the end of the day, and for good reason. So, if you see a healthcare worker, please thank them.
All righty. That's very well put. Dr. Ismail Mehr and St. James CEO Bryan ODonovan, I want to thank you both for coming on today.
Thanks, Brian.
Thank you.
Thank you very much. AM 1480 WLEA Hornell. We're going to be joining Brian Kilmeade after the 9:30 break here for news.